Imagine waking up at 2 in the morning. You stumble out of bed, half asleep, and make your way to the bathroom. Then it happens again at 4, and maybe once more just before sunrise. At first, it feels like a minor inconvenience, something you joke about with friends. Well, I guess this is what getting older feels like. But here's the uncomfortable truth many men never hear. For millions of men over 60, those nightly bathroom trips are not simply about aging. They are often the first quiet warning sign that something inside the body is changing. More specifically, something involving a small gland that most men rarely think about: the prostate. This walnut-sized gland sits just below the bladder and wraps around the urethra like a ring around a garden hose. And as men age, subtle biological shifts can cause it to gradually grow. Not suddenly, not dramatically, but slowly, year after year, until one day the changes start interfering with everyday life. Urination becomes slower. The bladder never quite feels empty. Sleep becomes fragmented. Energy declines, and many men begin to wonder if this is simply the unavoidable cost of getting older. But modern research suggests something very different. Many of the processes driving prostate symptoms are influenced by daily habits, which means small behavioral changes can sometimes produce surprisingly meaningful improvements. Today, we're going to explore 3 habits that research increasingly associates with prostate support. None of them require medication. None involve complicated routines. But together, they can influence some of the most important biological systems connected to prostate health: circulation, inflammation, and hormonal signaling. But before we explore those habits, it's important to understand why the prostate changes with age in the first place. Because once you understand the biology, the solutions start to make a lot more sense. The prostate plays a simple but important role in the male reproductive system. It produces a portion of the fluid that carries sperm. In younger years, the gland usually functions quietly in the background. Most men rarely notice it. But as decades pass, the hormonal environment of the body gradually shifts. Testosterone levels decline. At the same time, an enzyme called 5-alpha reductase converts some testosterone into a more potent hormone known as dihydrotestosterone, or DHT. DHT has a powerful influence on prostate tissue. In fact, prostate cells are extremely sensitive to it. Over time, this hormonal signal can stimulate gradual growth of the gland. This condition is known as benign prostatic hyperplasia, or BPH. And despite the intimidating name, it is extremely common. Studies estimate that about half of men in their 60s experience some level of prostate enlargement. By their 70s, that number rises to roughly 70%. The enlargement itself isn't usually dangerous, but the location of the prostate creates a problem. Remember that ring around the garden hose? When the prostate grows, it presses against the urethra, and that pressure restricts urine flow. This is why men begin to notice symptoms like difficulty starting urination, a weaker stream, frequent nighttime urination, the sensation of incomplete bladder emptying. Now here's where things become interesting. For many years, doctors believed prostate enlargement was almost entirely driven by hormones. But newer research suggests metabolic health, inflammation, and circulation also play a large role, which means the prostate is influenced by many of the same lifestyle factors that affect the heart, brain, and blood vessels. Most people understand that staying hydrated is important, but very few think about when they drink fluids. And timing can make a surprising difference for men dealing with prostate symptoms. Here's why. Urine is not just water. It also contains metabolic waste products that the body is trying to eliminate. When someone becomes mildly dehydrated during the day, urine becomes more concentrated. Concentrated urine contains higher levels of substances that can irritate the bladder lining. And when the bladder becomes irritated, the urge to urinate becomes stronger. This can worsen many prostate-related symptoms. But hydration timing introduces another factor. If a person drinks large amounts of fluid late in the evening, the kidneys will continue filtering that fluid during sleep, which naturally increases nighttime urination. For someone whose prostate already restricts urine flow, that can create a frustrating cycle of waking repeatedly through the night. One simple adjustment many doctors recommend is this: shift most daily fluid intake earlier in the day. Drink normally throughout the morning and afternoon, but gradually reduce fluid consumption during the evening hours. This does not mean becoming dehydrated. It simply means being more intentional about timing. Many men who experiment with this adjustment notice fewer nighttime interruptions and improved sleep quality. Sleep matters more than many people realize. Poor sleep can increase inflammation and disrupt metabolic health, both of which are linked to worsening prostate symptoms. So something as simple as hydration timing can have ripple effects across multiple biological systems. But water timing alone is not enough. The next habit involves movement. And surprisingly, it takes far less exercise than many people assume. When people think about exercise, they often imagine intense workouts. But one of the most powerful forms of movement for metabolic health is far simpler: walking. More specifically, short walks taken shortly after meals. Research in metabolic medicine has shown that light activity after eating helps the body process glucose more efficiently. Why does that matter? Because blood sugar spikes can trigger inflammatory responses throughout the body. Chronic low-grade inflammation has now been linked to many conditions, including cardiovascular disease, diabetes, cognitive decline, and prostate enlargement. When blood sugar rises sharply, the body releases insulin. Repeated spikes over many years can lead to insulin resistance, and insulin resistance is strongly associated with systemic inflammation. This inflammatory environment can influence prostate tissue growth. But walking after meals activates muscles, and active muscles absorb glucose directly from the bloodstream. This reduces the magnitude of blood sugar spikes. Studies have shown that even 10 to 15 minutes of walking after eating can significantly improve glucose regulation. For older adults, this is particularly valuable because it provides metabolic benefits without requiring strenuous exercise. But walking influences more than blood sugar. It also improves circulation. Healthy blood flow delivers oxygen and nutrients to tissues throughout the body, including the prostate. Better circulation also helps the body remove inflammatory byproducts. Over time, these small improvements can accumulate. One short walk may seem insignificant, but repeated 3 times per day, week after week, month after month, the metabolic impact becomes meaningful. And there is another habit that interacts with circulation and prostate health in a different way, a habit that many people find uncomfortable to discuss, yet research suggests it may play an important biological role. The prostate produces a fluid that becomes part of semen. Like many glands in the body, it continuously generates secretions. If those secretions remain stagnant for long periods, they can contribute to irritation or inflammation inside the gland. This concept has led researchers to investigate whether regular ejaculation might influence prostate health. One of the most widely cited studies on this topic followed thousands of men over many years. The research observed that men reporting higher ejaculation frequency appeared to have a lower incidence of prostate cancer compared with men reporting lower frequency. Scientists have proposed several possible explanations. One theory involves fluid turnover. Regular ejaculation may help clear older secretions from the prostate, reducing the buildup of inflammatory compounds. Another theory relates to hormonal signaling. Sexual activity influences several hormones and neurotransmitters that may indirectly affect prostate tissue. However, it is important to understand that this relationship is associational, not a guaranteed protective mechanism. Regular ejaculation should not be viewed as a medical treatment, but it may represent one factor among many that contribute to prostate health. The larger lesson here is that the prostate is not isolated from the rest of the body's systems. Circulation, metabolism, hormonal signaling, inflammation, all interact with one another, which is why these three habits, hydration timing, walking after meals, and maintaining healthy glandular function, may work best when practiced together. But there is one final point that cannot be ignored. Lifestyle strategies can support prostate health, yet they are not substitutes for proper medical care. Even when symptoms seem mild, prostate changes should never be completely ignored. Medical screening exists for a reason. Two common tools used by doctors are PSA testing and digital rectal examination. PSA, or prostate-specific antigen, is a protein produced by prostate tissue. Elevated levels in the blood can sometimes indicate inflammation, enlargement, or cancer. The digital exam allows physicians to physically evaluate the gland for abnormalities. Neither test is perfect on its own, but together they help doctors monitor changes over time. Early detection dramatically improves treatment outcomes for prostate cancer, and for many men, identifying prostate enlargement early allows symptoms to be managed before they significantly affect daily life. The goal is not fear. The goal is awareness, because the earlier the body signals that something is changing, the more options exist to address it. One of the most empowering discoveries in modern health science is that aging does not happen at a uniform pace. Two people can be the same age, yet experience completely different levels of vitality. Some maintain strength, mobility, and independence well into their 70s and 80s. Others struggle much earlier. Genetics play a role, but lifestyle plays an enormous role as well. The body constantly responds to signals. Movement signals the body to maintain muscle. Balanced nutrition signals the body to regulate metabolism. Quality sleep signals the body to repair and restore. And the prostate, like every other organ, responds to those same signals. Small habits rarely feel dramatic in the moment, but over time they compound. Just as financial investments grow through steady contributions, health investments grow through daily behaviors. A short walk, better hydration timing, thoughtful attention to the body's natural rhythms. These are not quick fixes. They are foundations, and foundations determine how well the structure of the body holds up over decades. If there's one message worth remembering, it's this: your body is constantly listening to the signals you send it. Every meal, every movement, every night of sleep, every small habit repeated day after day. Those signals accumulate, and over time, they shape the trajectory of your health. The prostate is just one small part of that larger story. But sometimes, paying attention to small signals, like a few extra nighttime trips to the bathroom, can lead to bigger insights about how the body is changing. And once you recognize those signals, you gain something incredibly powerful: the ability to respond, to adjust, to support your health in ways that may influence how you live not just this year, but the decades ahead. Because aging is inevitable, but the way we age is shaped by the choices we make every day. And sometimes those choices begin with something as simple as what you do tomorrow morning.